The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of The Genuine Article, and we're going to discuss in this article the REVERSE trial, an important trial that looked at cardiac resynchronization therapy in patients with mild heart failure. And with me, Dr. Bill Abraham, who's the director of the cardiology program at Ohio State University, and Dr. Christopher Leclerc, who was an editorialist, reviewer and editorialist on this manuscript, and is a professor of medicine at the University of Rennes in France. Bill, could you review for us the specifics of the REVERSE trial?
The REVERSE trial represents the first of the moderate to large-scale clinical trials evaluating the efficacy of cardiac resynchronization therapy in patients with either asymptomatic LV dysfunction or mildly symptomatic heart failure.
So this is really extending the application of CRT into a new group.
Yeah, clearly the intent of these trials is to see whether or not we can confer the benefits of CRT on a whole new population of patients other than those who currently receive CRT today.
And what were the findings of the trial?
I think the trial was encouraging. It did in fact statistically miss its primary endpoint, looking at the proportion of patients worsened according to a composite endpoint. But when one digs deeper into the data, there was a highly significant effect on remodeling. That is, hearts got smaller and stronger with cardiac resynchronization therapy. And this did translate into a 53% reduction in the need for heart failure hospitalization, and that was statistically significant.
So missed the primary endpoint, but hit two very significant secondary endpoints. And in a group of 600 patients, adequately powered and adequately treated, you would say?
Yes, I think these patients were adequately treated. The background medical therapy utilization of ACE inhibitors or ARBs, beta blockers was excellent in this population. And so I think we get a true picture of the potential for the addition of CRT in these patients. A couple of limitations may relate to, one, the size of the study. I think in retrospect, looking at this percent of patients or proportion of patients worsened, we were a little bit underpowered at the end of the day. The p-value was close, but didn't quite make it. And then we may also discuss periods of follow-up, because in this population of patients, the primary follow-up for the trial was 1 year in all patients. May have been a little bit short.
Okay, Dr. Leclerc, when you reviewed the paper, what did you feel were the strengths and weaknesses? Did you think this was a solid publication?
Yes, I think it's a very solid publication, and I think it's a major trial because it will open the door for new indication, I think, in the future. The problem, I think, with the REVERSE trial was that in this population who was asymptomatic or mildly symptomatic, the follow-up time was definitively too short. 600 patients is a large cohort, and the patients were well treated, so it was also a good point, I would say, for the trial. But I think that the time of worsening for all these patients of 1 year was definitively too short. And now we have the result of from the European cohort at 18 months, and this was presented during the last ESC meeting by Cecilia Linde. And at 18 months, the primary endpoint is positive for CRT. So I think that the study is a very good study, but the follow-up time was definitively too short with 1 year follow-up.
So what you're really suggesting was that CRT was a prophylactic value in reducing deterioration rather than producing immediate clinical benefit.
Yes, as compared to the previous trials such as the MIRACLE trial or the CARE-HF trial, so CRT was designed to treat the patient. In the REVERSE trial, we speak about prevention of heart failure, and I think it's a totally different aspect of the treatment. But at this time, follow-up time should be very, very long.
Well, with the longer follow-up time, sounds like it was more effective. In retrospect, do you wish you would have done exercise testing or some objective measure of exertional capacity?
Yeah, I think in this group of patients whose exercise capacity is not terribly impaired at baseline, and in the setting of a multi-center, multinational trial, probably be tough to demonstrate improvements in exercise capacity. So I think for these types of studies in patients with mild or asymptomatic heart failure, outcomes are really the best measure. And of course, there are other ongoing trials, larger studies enrolling up to 1,800 patients looking at this same or similar populations. I think the reverse gives us a very nice preview of what those trials may look like.
Right. Well, clearly the indications for a CRT seem to be expanding. It didn't work out in the narrow QRS patients, but that may bear some looking at. There are still questions about perhaps those patients with diastolic dysfunction. But here, in the reverse trial, I think we have our first evidence that in a group of patients who are relatively asymptomatic, that resynchronization therapy can be of benefit. Thanks a million for being with us.
Thank you.
Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.